The wrong diagnosis is the most expensive mistake in shoulder rehab. Not expensive because of the MRI or the insurance copay, expensive because of the months you lose chasing the wrong treatment, stretching a shoulder that doesn't need stretching, strengthening a shoulder that can't handle load yet, or just waiting for something to work itself out when it never will. After 28 years and thousands of shoulders, I can tell the difference between a frozen shoulder and a rotator cuff tear in under 60 seconds. And by the end of this video, I'm going to show you exactly how I do it and how you can perform this simple shoulder test in the comfort of your home. Hi, I'm Dr. Robert Moss, a fellowship-trained physical therapist and clinical specialist with over 28 years of experience in orthopedic manual therapy. On this channel, I help people over 40 understand their pain, take control of their recovery, and stop wasting time on treatments that don't work. Today, we're breaking down the two most commonly confused shoulder conditions, frozen shoulder and rotator cuff tears. They can feel almost identical, but they're completely different problems that require completely different solutions. Here's the problem. If you go online on the interwebs and you type in shoulder pain, you get 500 million results. Half of them tell you to stretch, half tell you to strengthen, some tell you to ice, some say never ice it, and almost none of them start by helping you figure out what you're actually dealing with. That matters because the treatment for frozen shoulder can actually make a rotator cuff tear worse. And the rehab for a rotator cuff tear can stall a frozen shoulder in its tracks. You cannot skip the diagnosis. So let me walk you through exactly what each condition is, how to tell them apart, and one simple test you can do right now before you ever see a doctor. Frozen shoulder, the clinical term is adhesive capsulitis, is not a muscle problem. It's not a tendon problem. It's a capsule problem. Your shoulder joint is surrounded by a flexible capsule of connective tissue. Think of it like a sleeve around the joint. In a frozen shoulder, the sleeve gets inflamed, thickens, and tightens down. It literally shrinks around the joint. Think like a vacuum seal around a steak. And when that happens, you lose motion, not because something is torn, but because the container itself is locked up. It typically moves through 3 stages. 1. Stage 1 is the freezing stage. Pain comes first, often at night, and range of motion starts to shrink. This can last anywhere from 2 to 9 months. I know. Stage 2 is the frozen stage. The pain may actually calm down, but the stiffness gets worse. You can't reach behind your back. You can't reach overhead. Getting dressed becomes a problem. This stage can last 4 to 12 months. Stage 3 is the thawing stage. Motion starts to slowly return. This can take another 6 months to 2 years. Now, here's the important part. Who gets frozen shoulder? It is significantly more common in women than men. It peaks between the ages of 40 and 60, and it has a strong association with diabetes, thyroid disorders, and periods of immobilization, like wearing a sling after a different injury. If that sounds like you, file that away. A rotator cuff tear is a completely different animal. This is a structural problem. One or more of the 4 tendons that stabilize and move your shoulder has been damaged or torn. It can happen suddenly, a fall, you catch something heavy, a car accident, or it can happen gradually over years of wear and tear and repetitive overhead use. A lot of people over 50 have partial rotator cuff tears and they don't even know it. The hallmark of a rotator cuff tear is not stiffness, it's weakness. You might feel a deep ache in the shoulder, especially at night. But the thing that really tips you off is difficulty lifting your arm. Weakness when you rotate the arm outward, or a sense that the shoulder just doesn't have the strength it used to. And unlike a frozen shoulder, the motion is often still there. You can passively move the arm, you just can't power it there on your own. The one test that tells you which one you might have. All right, here's the test. And this is the same thing I do in the clinic on day one. You're going to need someone to help you. Sit or stand comfortably. Let your arm relax completely by the side. Now, have that person slowly try to lift your arm out to the side or in front and overhead. Don't help them. Let your arm be completely dead weight. They do all the work. If that person can lift your arm all the way up, full range of motion, but you can't do it yourself, that's a rotator cuff problem. The motion is there, the strength is not. The second option is if that person tries to lift your arm and it stops, it physically will not go any further, no matter who's lifting it. That is a frozen shoulder and it's locked. The joint itself is locked up. That is the second condition. That single distinction, passive range of motion, is the most reliable first pass screen I use after 28 years of practice, and it takes about 10 seconds. Now, this is not a formal diagnosis. You still need a proper clinical exam and possibly some imaging, but this will point you in the right direction and give you the language to have a much better conversation with your provider. Now, if you're watching this and thinking, I think I know which one I have, but what do I do about it? I put together a free guide called the Shoulder Owner's Manual. It covers the 5 most common shoulder conditions, what each one actually feels like, when you need to see someone, and the specific questions to ask your doctor or physical therapist so you don't waste time on the wrong treatment. The link is in the description below. It's free. Go on and grab it. So now you have a much clearer picture. Let me leave you with the framework I use with every patient who walks through my door. I call it the 3D method. Number 1, don't ignore it. Shoulder pain that lasts more than 2 weeks is not going away on its own. Waiting is not a strategy. Number 2, don't mask it. Anti-inflammatories and ice can take the edge off, but they are not fixing the underlying problem. If you're on month 3 of ibuprofen and still hurting, that is a signal, not a solution. You need to do something about it, which leads us to number 3, which is do something about it. The third D in the 3D method. Get evaluated by someone who understands shoulders. Ask for the passive range of motion test if they don't do it in your exam. Ask about imaging if it's warranted. Most of the time it's not if you have a very good clinical exam. The faster you get the right diagnosis, the shorter your road to recovery. Whether this turns out to be a frozen shoulder or a rotator cuff tear, both of them respond to the right treatment at the right time. Neither one is a life sentence. Both of them get harder to fix the longer you wait. If this has helped you understand what's going on with your shoulder, do me a favor. Share it with someone who's been struggling. They might be one video away from the answer they've been looking for. And if you want the full breakdown, all 5 major shoulder conditions, the home test, and the exact questions to ask your provider, download the Shoulder Owner's Manual. It's free. Link is right below. I'm Dr. Robert Moss. Move well, live well. I'll see you in the next one.